Hey there, YouTube. Wayward Nurse here. Of course, you don't know me as the Wayward Nurse yet because I haven't released my introduction video. But something came up and thought that this video would serve as a better first video. So let's call this a preamble to the channel. The thing that came up is I had a dream. Now, I'm an ICU nurse here in Indianapolis. I work at a level 1 trauma center, and I take care of a lot of sick people, a lot of hurt people. And I had a dream that I didn't at first recognize as a work dream. And I'm going to share that with you now in hopes that it might encourage someone, in hopes that it might help someone else feel like they're not alone. So real quick, the dream. I was in a dark, really twilight field, and it was cold, and there was a bunch of people around a funeral pyre. And on this pyre was someone traditionally wrapped in a linen cloth, and they were bound. They were bound with ropes. This person was still alive, and they began to whimper. And so I approached, and I held their head, and as I held their head, someone lit the fire, and the person began to cry that it hurt. I stroked their head, and I told them, I know it hurts, but it'll all be over soon. And then I woke up. Then I went to work. And I helped people suffering that. Family won't let go, or providers are being overly optimistic with their prognosis, and I can't do anything but try to comfort that person, despite my education, despite my expertise, despite my certifications. So I held their hand and I told them, I am so sorry. I really wish I could make you feel better. As I reflected on it, though, I recognized that, there is a great deal of good to be done in comforting the dying. Anybody that has worked with palliative care, hospice, anybody that's seen that work performed, anybody that's been in healthcare for more than a minute knows that not all interventions are curative. But not everybody knows that just because an intervention isn't curative, it doesn't mean that the situation is hopeless. Now I'm tired and I'm burnt out, and part of that is because of how much I work. I work a lot of overtime. But we as nurses are called to be a light. We're called to be a light to our patients and to their families and to our coworkers, even when it hurts. So be a light.